it at 10 minutes. Very good.
Mr. Speaker. Where I began was to say that I think I speak for all parliamentarians when I say how surprised perhaps we are at having to deal with this completely unique situation that has faced not only our country but our globe. And I think that none of us envisioned that we would be dealing in 2021 with such a colossal dislocation in our communities, in our economy, in our families, in our healthcare systems as we've been confronted with. And I think equally I speak for all parliamentarians when we say that the hope that we all have to restore us to some sense of normal, hopefully a better normal, is that we all get access to a quickly administered and broadly effective vaccine or treatment. So the proximate cause of this very important debate tonight is Canadians' concern about the impact that delayed shipments of the Pfizer vaccine will have on our country's vaccination schedule. And of course, this was generated by news last week from Major General Danny Fortin, our military commander overseeing vaccine logistics for the federal government, who confirmed that Canada will receive only 1/3 of expected deliveries between January 18 and February 7. Now, this was the third time in 2 weeks that the federal government's delivery schedule was revised downward. Canada won't receive any COVID-19 vaccine doses this week at all, and will only receive 79,000 doses in the first week of February. That's 1/5 of what was once expected. Major General Fortin has yet to confirm how many doses will arrive during the second week of February. Now, despite previous assurances from the Liberal government that countries will be impacted equally by supply reductions, in fact, the European Union will have a much shorter interruption in deliveries than Canada. But even before this delay, Canada's vaccine rollout had fallen far behind that of our closest allies and trading partners. For example, last week, the United States administered an average of 1.16 million vaccine doses per day. But as of today, Canada has only administered a total of 863,000 doses overall. Now we hear that the Biden administration is aiming to provide vaccines to 1.5 million Americans per day. The Government of Canada, by contrast, hasn't even established a daily target. Now, the current government claims that the current supply interruption is a temporary and isolated incident due to a factory expansion at Pfizer's Belgium plant, but unfortunately other factors could further disrupt Canada's delivery schedule. In fact, just today, the European Commission announced a new plan to require companies to register any exports of COVID-19 vaccines out of the European Union. The EU is also poised to impose export controls to preserve supply on that continent. That proposal would require drug companies to seek approval before shipping vaccines to countries outside the trading bloc. Now, given that Canada is entirely dependent on importing COVID-19 vaccines, we could very well find ourselves squeezed by this growing vaccine nationalism. So that's the specific context for the debate, but there's a broader context, Mr. Speaker. The broader context is this. The Prime Minister's talking points really amount to this. We have secured the biggest portfolio of vaccines in the world, and don't worry. Now, the truth is this. Canadians aren't interested in how many vaccines we could get. They are interested in how many vaccines we will get. Moreover, the federal government response on the entire COVID file, in my view, has been slow, weak, and inconsistent. It has been marked by a shocking lack of transparency, and that is now borne out in performance. Canada is now 16th in the world in terms of vaccinations per capita, and we still have no clear plan for vaccinations in this country. Now, that is why New Democrats are calling on the federal government to do a number of things to rectify the situation and fulfill the dreams and the hopes that Canadians have for returning their economy and health to a more normal state of affairs. First, we're calling on the federal government to establish a public drug manufacturer so that Canada is never again dependent on foreign drug companies for vaccines and critical medications during a pandemic. It's a well-known fact by now that this government failed to negotiate with a single one of the 7 drug manufacturers the right to manufacture a COVID vaccine in Canada. Many other countries did so, including Australia, India, China, Malaysia, Japan, etc. And yet we still can't receive a single explanation from this government why they failed to do so in this country. And today we are seeing the results of that as we wait, receiving no doses of vaccine while we see vaccines produced in other countries by other companies. In the immediate term, the federal government has an obligation to outline a detailed plan in case Canada's vaccine supply is further curtailed. Now, this morning, the Prime Minister claimed that he is very confident that Canada is going to receive all promised doses by the end of March 2021, and he claimed that our vaccine supply is in, quote, good shape. However, he provided no explanation for this confidence, and confidence is not a plan. Unfortunately, the Prime Minister's glib response typifies the federal government's opaque, confusing, and often contradictory approach to communicating Canada's vaccine plan. As I said, for months, the federal government has been totally secretive about the terms of the deals it signed with drug manufacturers. It has failed to release a single word in a single contract of the 7 contracts they've signed on behalf of Canadians. Now, this is not only unfair to the taxpayers who are paying for these doses, but transparency is essential for maintaining the public's trust and confidence in Canada's vaccine strategy. Taxpayers also have a right to know how their money is being spent. And the provinces and territories need clarity from the federal government in order to adjust their vaccination programs in response to supply shortages. New Democrats are also calling on the federal government to do the following: reveal how many vaccine doses have actually been secured for each month until September 2021. Confirm if Canada is actually guaranteed delivery of 4 million doses of the Pfizer vaccine by the end of March, and what recourse is available to us if this deadline is missed. Provide full transparency on the terms and conditions of all vaccine supply agreements between the Government of Canada and drug manufacturers. Furthermore, Mr. Speaker, the Prime Minister insists that Canadians don't need to worry about the current vaccine shortage because the government's goal of securing enough COVID-19 vaccine doses to immunize all Canadians by September remains feasible. But this talking point obscures the grim reality that Canada's current supply disruption will have severe consequences for our most vulnerable citizens. Indeed, Canada's vaccine shortages will further delay inoculation for our country's highest risk populations: seniors, long-term care residents, Indigenous communities, teachers, first responders, and frontline healthcare workers, at a time when COVID-19 cases are surging and highly contagious COVID-19 variants have reached our communities. Every day that COVID-19 vaccine rollout is delayed will result in avoidable infections and deaths across Canada. That is not positive news. The Public Health Agency of Canada's latest modeling projects that Canada is on track to hit 10,000 new daily cases by February. We remain on a rapid growth trajectory with widespread community transmission and increased outbreaks in long-term care facilities. Now, public health experts are also issuing dire warnings that dangerous COVID-19 mutations could undermine Canada's COVID-19 efforts. Yesterday, epidemiologists from Simon Fraser University warned that a massive spike of COVID-19 cases could be coming to Canada if the UK variant becomes further established here. The researchers looked at the exponential growth of COVID-19 cases linked to new variants of concern and concluded that failure to prevent or contain these strains now will spell disaster for Canada as early as March. Now, the authors don't expect to see much impact for about 6 weeks. However, if and when the spike comes, they expect it will come steeply with a doubling time of 1 to 2 weeks. This represents a sharp increase from the doubling times of 30 to 40 days recently recorded in provinces like Ontario. The UK variant is believed to have a substantial transmission advantage of 40 to 80% increase in the reproduction number. At transmission rate increases an increase of this magnitude is worse than a higher severity or mortality rate because so many more people can get infected. In most of Canada, we have been able to control previous variants of COVID-19 with strong physical distancing measures. However, we're being warned that a variant with a 40% or more increase in transmission rate would likely not be contained with the measures we have in place today. Therefore, instead of relying on the Prime Minister's ambiguous assurances and unfounded confidence, we must be willing to act decisively to curtail the spread of COVID-19 in Canada now. The federal government must take immediate steps to prevent the introduction of new variants into Canada through stricter border controls, a ban on non-essential international travel, mandatory hotel quarantine like Australia and New Zealand have introduced, and improved detection. The federal government must also take immediate steps to prevent the spread of COVID-19 within Canada through additional essential public health measures such as paid sick days, national standards for long-term care, frequent rapid tests.
We'll now go to questions and comments. Questions et commentaires. The honourable member for Winnipeg North.
Yes, thank you, Mr. Speaker. And in listening to my colleague's comments, one of the things that stood out is I believe he said something to the effect of that the United States president is now saying, I think he said 1.1 million a day. And he seemed to kind of like really emphasize as if that's a real good thing. And if you take a look at that number, and please correct me if I'm wrong, that would then imply that sometime by the end of the year, all Americans south of the border will have been afforded the opportunity to be vaccinated. We have made a commitment to Canadians through the process that we have.
We have an appel au règlement. L'honorable député de.
Point of order, the honourable member for Shefford.
For Winnipeg North, oui.
Please go ahead. There's no more interpretation for the member from Winnipeg North.
De traduction ce soir.
There's interpretation problems this evening.
See if the translation is working. Ça fonctionne? Okay.
It works. It works. The honourable member for Shefford, can you hear?
Tout est arrangé? Parfait.
Everything's good? Yes, I can hear you.
The honourable member for Winnipeg North, continue then.
Yes, thank you, Mr. Speaker. And the essence of the point is this. The member makes reference to the United States 1.1 million a day and kind of hit home that particular point. That means that they would have their population done sometime towards the end of the year. We have made through our plan a commitment that every Canadian will have a safe, free vaccine made available to him and her before the end of September. We've made the commitment that there will be 6 million vaccines by the end of March. And I wonder if he would not agree that, the way in which we present things can be somewhat deceiving. And the reality is that there are tangible numbers that are being shared with Canadians and the provinces by this government.
Member for Vancouver Kingsway.
Well, just to correct my honourable colleague on numbers, no, the United States is vaccinating 1.1 million Americans a day last week, and they announced today that they're going to move that to 1.5 million Americans each day. Now, if you compare that to Canada, that means the Biden's administration commitment that they will do 100 million Americans in the first 100 days is about a third of the Americans in 3 months. You compare that to Canada, where we're talking about 6 million doses in 3 months. That's about 3 million Canadians. That's 8% of the Canadian population. So you can see that the Americans will have a third of their population done within about the first 3 or 4 months and will be less than 10%. The other thing about this, of course, is that the Biden administration is announcing a plan. Not just a future goal with a commitment to vaccinate everybody, but an actual plan with numbers per day. I challenge you, my colleague, tell Canadians, how many Canadians are going to be vaccinated every day between now and the end of this year in this country?
Questions and comments? The honourable member for Calgary Nose Hill.
Sure. I really liked what my colleague said with regard to framing out this debate, it's not the Prime Minister's vaccine. It's Canadians' vaccine, and they actually deserve to know when they're going to get it, under what terms, how much we paid for it, if we're actually going to get it at some point. And I think that's really information that we haven't received to date. So I'm just wondering if my colleague could expand upon that comment, talking about the fact that the federal government shouldn't continue to be opaque with the information that we need to understand when we're going to be getting these vaccines, from which manufacturing company, under what circumstances, and how this lack of information has actually stymied both Parliament's job in holding the government to account on this critical issue, but also the provincial government's ability to deliver vaccines in a timely manner.
Member for Vancouver Kingsway.
Well, thank you, my honourable colleague, for that question. You know, this is another question that is repeatedly asked of this government for which they refuse utterly to answer. And that is why they refuse to release a single line in any of the 7 contracts they've negotiated on behalf of Canadians. And they won't tell us why. Now, we all understand that there may be commercially sensitive information. There may be some technology secrets in the documents. There may be some confidential aspects that may interfere with the government's ability to negotiate. But surely there is information in those contracts that Canadians have a right to know that don't fall in those categories. Yet this government won't release a word. Now, what does that tell Canadians? How can that inspire confidence that this government really is backing up their rhetoric with reality? You know, if you go to a lawyer and the lawyer says, don't worry, I have everything taken care of, and you say, well, let me see the paperwork, and they tell you, well, you can't see it, that is not going to inspire confidence that that paperwork backs up the words that are being spoken. And I think it's time that this government trusted Canadians with the basic information in those contracts and assisting the provinces and territories with planning their vaccination, because it is provinces and territories who are responsible for rolling out the vaccination plans. They can't do so if we don't know the basic details from this government that they're so carefully and so inexplicably hiding.